All right, welcome. Welcome to the Geese Squad, a space we've created to share all life throws at us on and off the mats. And sometimes it includes jujitsu, sometimes not completely, or how it's influenced us also. Positive, negative, we share it all. Mm-hmm. Today we have a really special guest, and this topic is a beautiful one because it's one that applies to everybody. Athletes, whether you do martial arts, jujitsu, karate, taekwondo, all the things. You do yoga, tennis, pickleball, everything. This can influence everybody. When we're in our early 20s, we tend to ignore those aches and pains and we can get away with it. But now as we get older, we can't always ignore it and we shouldn't probably. So today we have a really special speaker. She is a doctor of physical therapy, and this is Dr. Amber Searcy. She has been doing orthopedics for over 13 years. So for me, ever since I started doing martial arts, anytime I think about anybody who's done anything for more than 10 years, I'm like, she's a black belt in this topic. So I'm really excited. We're really excited because we want to pick your brain. You have all this knowledge, you know your stuff. And so we're looking forward to speaking and asking you all the questions. Before we do, I do want to formally introduce you and share with everybody all of her titles, everything she's licensed in. So like I said, she's a doctor of physical therapy. She's an orthopedic clinical specialist. She's certified in lymphedema also, and Graston technique as well. She also does she's certified in dry needling, which I love. And, because that's not enough, she also is a certified Polestar Pilates instructor, which I kind of want to ask you questions about at the end and see if it's a really good supplement maybe for jujitsu. I don't know. We'll pin that. We'll talk about it at the end. But please, we want to hear from you. Tell us how you got into physical therapy and what you love about it. What keeps you going with it right now?
Okay. Well, thank you. It's a pleasure to be here as well. So how I ended up in physical therapy, in undergrad, I ended up joining the track and field team at the school, and all the trainers that they had at the program were also in this kinesiology sports medicine program. And it was at the end of our second year where we were talking with one of the trainers, and she starts bringing up this program because the first years of college, I took every class to see what would interest me. Mm-hmm. Econ.
As we all do.
Yes. I found out all the courses that did not work for my style
off the list.
Not for me. And so she mentioned the sports medicine program. I'm like, that sounds interesting. So when I was at school, it was only a 2-year program. You had to apply at the end of your second year. You got in, did the 2 years. They have now since changed it, and it's grown so much. It's now become a 4-year program, and you have to apply before you even get into the school. In that program, the majority of people ended up going on to physical therapy school. Some went to med school, dental school, but the majority did PT school. And it was through that program where you take a wide range of courses, whether it's exercise physiology, training, whatever it is. And through that, I ended up going into physical therapy, and I did my undergrad at University of Virginia, and then went to University of Miami for grad school and did the 3 years there.
Nice.
And then to be a PT, do you have to be a doctor in physical therapy?
Now you do. Way back when, it used to be a bachelor's program, then a master's, and now it's become a doctorate program. Wow. So now anyone who graduates nowadays will be coming from a doctorate program.
Interesting. Okay. So what is, you talk about kinesiology? What is kinesiology?
Kinesiology, the study of movement.
I like that.
Sounds appropriate for us.
I have no idea.
Very much so.
Yeah.
Ooh, I don't know anything about that either. So is it how every movement affects your body, or tell us a little bit? Zero knowledge.
So within that program, there was the exercise physiology track. There was this sports medicine track. And then there was also the adapted physical education tracks. And we had to take courses in all of them. And it gives you just a wide range to kind of prepare you for it. Honestly, I felt like I was very prepared going into physical therapy school when I took that kinesiology program, just because you're already learning so much about kind of the body, how it moves, the science behind it before you even enter the program.
That's awesome. So before you work on a physical therapy office, have you worked in a hospital before, correct?
I worked mostly doing outpatient therapy, but part of it was based inside a hospital in that setting, which was nice because then if you have a cancellation, you could go in and see patients on the floor. So I did have a mixture of acute care and outpatient while I worked in the hospital.
And you're an athlete yourself, right? You run, is that right?
I grew up doing soccer. I played soccer for over 8 years, kind of got burnt out, switched to track during high school, and then did track for the first 2 years of college. And then once I got into the sports med program, because I'd spent so much time taking courses I ended up not needing, I had to do 19 credits a semester my last 2 years. So I had to stop track in order to get the credits I needed in order to graduate.
Yeah. Yep. That happens. But we're interested to ask you a lot of questions. I know our listeners are all like, most of them are jujitsu practitioners, or there's some that aren't, but we all move our bodies, like you said. So like our bodies are being affected by it. So we have a lot of questions about, maybe we want to pick your brain on things that you suggest people do maybe to prevent any injuries, for like stretching, mobility. What we see all these fads, you see it all on Instagram, all the reels. What do you personally, what do you suggest? What do you do? We want to know it all.
So I will say, over the last few years, I myself personally have been dealing with a lot of injuries that have flared up off and on. And as I've noticed as well with getting older, is the importance of a proper warm up and getting your body ready for movement. Because it used to be, you wake up, you roll out of bed, I would just throw on my clothes, start running and go. And now it's like, okay, I have to wake up, maybe do some active stretching, do whatever I have to do, start like waking my body up, getting it ready. But not only is it the pre-workout, but also your post-workout. Because I have patients that come in and they go, oh yeah, I did a hard workout. I did like an exercise bike class for 30 minutes, 45 minutes. But then I had to go sit in the car and I drove for 2 hours. And then everything stiffens up. And then now they're in pain, or they locked up and they can't move. And that happens so often that so many people, or especially in Florida, it gets so hot. And then you come inside to the air conditioning and they just don't do anything. And then they lock up again, or they start to get into other muscle spasms from older injuries that they have. So it's also the cool down after a workout is also important. And do you want me to go into that now? As far as what I
mean, I feel like probably all our listeners, because I'm pretty sure we all feel attacked right now, because we're like, oh, she's talking about me. We're talking about,
I'm like,
I don't know.
We're so guilty.
I'm very guilty.
And we always say it's like, do as I say, not as I do, right? Again, I've always been horrible about it, but I've had to force myself recently because of the injuries.
Yeah.
So as far as warm up goes, if you can at least spend maybe 5 to 10 minutes, depending on what activity you plan on doing next. And that's active movement. So whether it's like light walking, moving, active stretching. What is active stretching? Active stretching is where you're just taking your body in and out of different movements. You're not holding the pose. So most often when you think about, like, let's say people do a quad stretch, right? And they stretch their thigh, they pull their knee back and they hold it for a long time. That's not what you want to do before you work out, because that's actually causing your muscles to slow down. That's stuff that should be done after you exercise. So that's in the post-workout, because that causes more muscle inhibition. So you could do a quad stretch, but it's more active. Like you pull your knee back, relax it. Pull the other side back, relax it. So it's moving. Like in and out of movements. Yes. Hip circles, where you just kind of like a hula hoop motion with the hips, or arm circles, arm swings, all those things that you're starting to kind of prime those muscles to get them ready to function and move. 5 to 10 minutes. So you're not trying to hold any position for long periods before you work out. After you work out, you're trying to bring that heart rate back down gradually. So you don't just go from a hardcore, you're pumping everything, to then all of a sudden you stop and you sit, but you're trying to kind of bring it down again, 5, maybe 10 minutes, depending on how long or aggressive your exercise session was. And then that's when you can start to work slowly into those static stretches, where you then start to hold them to kind of lengthen them and to ease them out. You can still do some active, but that's when your static would be more beneficial, not before you work out.
Do you notice a certain amount of time? Because I'm really bad if you don't tell me, like, you have to do this for 20 minutes, I'm going to do it for 5, I'm going to sprint through it. So do you notice, like, you got to give it a certain amount of time to warm up at all?
I think it's very dependent on what you're doing, right? Like somebody who's going out to play golf, they're not really getting their heart rate up that crazy. So they might only need a few minutes to run through some active motions. If are familiar with like cat-cow, like spinal mobility, the hip circles, things like that. So it might only take them a few minutes. But if you're going to be doing more of a weight lift and it's a much more aggressive exercise you're doing, then you might have to spend a little bit longer kind of getting to there. So you don't just go from, okay, I just walked in the gym, now let me just start curling.
Okay. Yeah. And do you suggest like mimicking the movement that you're going to be doing? So like if I'm going to do heavy squats today, should I be doing like some quick squats up and down, air squat? Okay.
Yep.
All right.
Yeah. Actually, that is a great way. That is a perfect way to do an active exercise to warm up, is body weight before you do the heavy one. Yes, it was perfect.
Okay, cool. What about weight training? Do you suggest building weight training into kind of your prevention also, or recovery?
Yes. Especially as we age, And it's more so for women too, because like bone density becomes an issue as we get older. Yeah. And they've looked at it, and like people who go in for knee replacements or like a joint replacement surgery, right? They've shown that it actually can decrease their bone density just from that time off that they've had post-surgery because they're not doing anything. So that alone can already affect your bone density just from taking that time off from surgery. So strength training is super important, one, just for bone integrity and just maintaining that, but also your functional movements. Because how often, do you start to go through your day and like, I don't ever do this. Like I don't reach up and lift things overhead, or like stairs in Florida, everything's flat. People forget how to do stairs and they lose some of that strength and weakness. So it is important to keep that up, just prevention of falls, just functional, what you need to do throughout your day so you don't get injured. And there's different types of strength training too, right? Because you think about like the Olympic style weightlifting, you're doing low reps, but higher weights, right? So you might only do 3 to 5 reps where you lift it up and down, but your weight is going to be a lot higher. That's when you're really trying to build that muscle girth and like strength. General strength training, most of us are not doing that heavy aggressive lifting. We're thinking more of that 8 to 10 rep session. We always say 10, it's a number. If you get to about 7 to 8, you're in the right range for your resistance. You want to feel fatigued by the time you get close to that 10th rep. Like I said, it could be 7, it could be 11, but you're in the ballpark. If you can do 15 to 20 reps of that rate, it's too light. You're working more muscle endurance at that point, which could be your goal. Maybe you need to do a lot of muscle endurance for whatever your activity requires. But if you're trying to work on the strength to actually make those strength gains, you want to aim for enough weight that by 10, you want to take a break, and then you can do a couple sets of that.
That makes sense.
It does, yeah.
Yeah.
I feel like it's good information to like remember. I got to remember
These are like
this.
things you don't think about too. Like it sounds so practical and logical when you say it, but when you're doing it, you're like,
I'm just going to do this real fast.
I'm just going to do it real quick and then be done with it, and then I'll be good. And that's my workout for today. And it's like that. It's so much more in your body. You might not feel it right then and there, but eventually you will. And when you do feel it, I think that's when it comes to a point where, it's like you have to do serious repair because your body will give you little signs, I think. And then, I think I definitely have to stretch after.
Yeah. And,
I'm not good at that.
So I have a question. How would you tell the difference between, like if you're doing strength training, how would you know the difference between the soreness or an injury?
That's a good question.
So typical muscle soreness, I usually say, it's not bad.
What is the flags there?
So I usually say it's not bad to be sore because that means you actually did something. Because you have to challenge your body. So muscle soreness for 1 to 2 days, as long as it's not getting worse past that second day, I usually say is a good thing. If it's continuing to get worse, going into days 3 and 4, you've done way too much because it shouldn't be that bad because then it kind of slows your body down for recovery because it's a lot. So muscle soreness, as long as it's a little sore, but you can kind of like walk through it, work through it, but it starts trending down by the day 2, I typically am fine with. But if somebody comes back to me 3-4 days later and they're still hurting,
it's getting worse.
Yeah, I don't like that. That means it's too aggressive for their body.
What about, so if their soreness or their ache goes away, but it comes back in like a week or 2, is that also something that people should look out for?
So soreness versus injury. The injury is that kind of gnawing, throbbing, like sharp pain. Sharp pain I definitely do not like. But if somebody's a little stiff, right, and they start to do their active warm-up, because if somebody's like, well, I don't know, it feels uncomfortable, it's like, okay, we'll start doing your active warm-up. Does it start to go away? Does it stay the same with the intensity level, or does it get worse? If what you're doing is getting worse while you're doing some basic movements, stop. You're not supposed to go past that. If it starts to lighten up and it goes away, typically I say, okay, maybe it was just a little stiff, and all you had to do is just kind of work through it, loosen it up, warm it up. Exactly. Because I don't mind them doing things, but if they start to do those exercises, they've loosened it up, they're feeling better. But then that sharp pain comes back, you have to stop.
Yeah.
So that's, I would say, more the difference between the injury versus soreness is one, how long it lasts, right? Because if it's lasting now, this pain or discomfort for a long time, that's probably your body telling you something's not quite right. Like for people's shoulders, right? If they did a lot of overhead and they're like, well, it's kind of lingering now. It's been, a week or 2, but I keep working it out. It's like, no, that's something, you're irritating something, because the typical soreness from workout should go away.
It's funny how you say that. We do a warm up before our jiu-jitsu classes. It's always the same warm up. It's great. And it's actually incorporates a lot of the movements that we do. So I'm thinking, hey, we're doing something a little bit right. We just probably need to add a little bit more.
Yeah.
Personalize it a little.
Yeah.
But when we do those warm-ups, one of the rules that I did for the first bit of doing jiu-jitsu is I thought if something hurts during the warm-up, I'm not going to roll today. And rolling's when we grapple and fight. And I've recently been ignoring that, and I've definitely injured myself. And I'm kind of giving myself like a lecture to myself right now as you're saying, like, hey, I should be listening to my head, and what she's saying is spot on. So definitely if in the warm-up, if we're feeling it, we tend to push past. We're all stubborn and we're tough, right?
And
we're all
a lot of women do that too, I think, just because we're so used to it, especially we have children.
push through the pain once a month, at least.
You usually just got to keep it going, keep it moving, and it'll eventually go away or something,
Yeah.
I
But
was just thinking the opposite. So maybe Monday I'm gonna roll and see if this pain is gonna go away.
I'm gonna have to slap you.
It's like, oh.
Maybe do the warm-up movement. She was saying maybe pretend that you're doing a roll and see how it feels before you incorporate the
I'm
full
gonna roll
roll.
very hard.
You want to roll with me?
Yeah, and then see
Fall
what's gonna
apart.
happen.
Maybe it'll pop back into place. Is that what you're thinking?
That's like the worst.
Because like I'm doing everything.
Yeah.
So maybe I should do the thing I'm not doing.
Yeah,
You
yeah.
start to go through these, I think, like loops in your brain.
We trick ourselves.
Yeah.
It is. Well, there are times too, right, where some people, when they get injured, they don't want to do anything because they're afraid to
Scared.
make it worse.
Yeah.
But there are times where some light movement actually helps your body recover so it doesn't get stiffer or worse.
Yeah.
So, and that's the tough thing, right? Because you're going like, yes, your shoulder might hurt, but are there other ways you can still work on strengthening it, moving it without aggravating where the painful side is?
Yeah.
And that's what you want to do. Because then otherwise, if you don't do anything, you lose the strength gains that you've made. You lose some of your flexibility.
And
And
that
that's
scares
when it
me.
can get worse. And then your risk of injury goes up because then you've stopped moving that area. So you want to still continue to do exercises to support to strengthen and build around it without irritating it. And that's the key.
I feel like we could have an episode on each, like the knee, the arm. Like we're gonna need you back a couple times. Because,
Every body part.
yeah, there's a lot of questions for each specific thing, but that's really good to know. And it's true. We do get really scared of doing anything, and then the lack of mobility makes it worse.
Yeah, I believe it does. I believe, because I've injured like slightly a few things, and then, things where I can still move, like my hand or like my rib or, stuff like that. And I'll just not move it really or do anything with it for like the first week, just something normal, wrap it. That's what I did, anti-inflammatory, And then I take a lot of herbs and stuff too, and essential oils, and, to make sure that there's blood getting to the area, the surface, wherever it may be. And then the second week I was like, all right, I'll try and roll, but I'm going to keep this arm in. So my body's still moving, the blood flow it's still going. And I'm not really moving this too much. And I'm learning how to move it with the rest of my body without it. So I think that helped me for like the smaller injuries that I've had, is to continue with movement, because blood flow, it heals your body, right? Just like rest does. So I think it's finding that balance in between of, after an injury, of taking care of it and resting, but also still some activity, so you don't just lay dormant, because then I feel like there's no blood flow. How is it supposed to repair?
Yep.
So you touched on something real quick. What about supplements? What do you take, or what do you suggest? Like personally, like, disclaimer, you can do whatever you want, but tell us what you've seen that you've told patients and it seems to work or anything.
So I will say, as a PT, I cannot tell people what they can and cannot take, but I always say, if your doctor's allowed you to take something,
disclaimer.
and then within reason, you can take it. So for some people, yes, if you have an inflammation or acute injury, then anti-inflammatories typically will help with that, as long as you're allowed to take them and there's no interference with that. There's other talk about, turmeric and other things like that are more herbal based that can help with some inflammation, which people help. If it helps you, I say go for it. Icing can be helpful too if it's acutely sore. Now, I touch on this because I will bring up cold plunges. Many people do cold plunges nowadays. If you're doing your exercise, like a heavy weightlifting session, you do not want to go immediately into a cold plunge right when you finish, because a lot of people think, oh, this way I won't get sore. That actually will inhibit your muscle growth, and it actually stops the gains that you were
working on.
towards. So you don't want to do it right afterwards. But if you did it maybe the following day or you waited, then you can definitely go into the cold plunge. But you don't want to do it immediately after a hard workout. But if it's an area where it's sore, like an injury, or if you did something, then yes, you can throw ice on it after that shoulder. If you're like, it's a little achy, I'm not sure. You can throw ice on it for 10, 15 minutes. Okay. And then you can take it off and it's fine.
For how long? How long do we do that for, the ice?
So
like how many days or,
The first few days. So if you have an acute injury, let's say you just felt something, right? Your body's natural inflammatory cycle, which helps with its healing. It's normal. Your body needs to go into that inflammatory cycle in order to heal. But sometimes our body goes into overdrive with it. And that's when people swell too much. Like you think about a sprained ankle, right? You roll the ankle. The first 3 days is when the body's going to really kick in and peak as far as that swelling and trying to get that session going. It takes up to about 21 days, almost 3 weeks for part of that inflammatory cycle to heal. But the full recovery can take weeks or even a couple months longer, depending on how severe the injury is. So the first few days, I always say like the first 3 to 5 days, you can ice it off and on or longer, depending on if there's a surgery. Other surgeries, I encourage it longer. But at sprained ankle, I would say off and on 10 minutes. The reason why we don't want you to ice for like an hour at a time, because people go, I put ice on it for 2 hours. It's great. I'm like, oh gosh, please don't do that. Because when you leave ice on longer than that time period, you want it to there's the stages of where you start to, I say freeze the area, but it gets cold, that burning sensation that goes numb. Once you get that numb sensation, take the ice off. Okay. If you leave it on, it actually causes your blood vessels to open up and bring more blood flow to the area, which is the exact opposite of what you were trying to do when you put the ice on it. So you never want to just leave it on for the 2 hours. It's why it's only just until it goes numb or that 15, 20 minutes, give or take, depending on the size of the area you're putting ice on. And then that's it.
I'm like a wuss with cold, so I feel it numb in like a second.
Like 2 minutes. Me too.
And I take it off, and my husband's like, you need it
I'll
longer.
watch. I'm like, it's been 5 minutes. This is fine.
So I'm happy to hear it shouldn't be on too long, so I can start using that as my excuse. But it's good to know, because I think a lot of us picture like an injury and then it gets inflamed and it's super sore, and we put ice on it that first day, and then we think, it's no longer inflamed after like days. You know what I mean? Like, we think it's taken care of. And now is when I've learned through my own injuries that I'm like, this is still inflamed weeks later, and I should still be doing things to help it, to try to make it better, rather than just thinking that it's no longer inflamed, because it doesn't look inflamed, for example, but still dealing.
And I always say the swelling, it's horrible for people's recovery, right? As far as getting back to where you want to be. The most common example I'll give you is like with a knee. People have like ACL injuries, surgeries, or the knee swells, right? When you have swelling in that knee joint, it automatically shuts down how much your quad muscle will function. Okay. So if you have swelling in your joint, it can limit it to up to about like 25% or so. So even if you had full strength, it's not going to be as strong as it would be otherwise, as long as there's swelling in the knee joint, which is why getting the swelling down is so important for people's recovery, so they can get back faster. Because when people are like, it's swollen, I'll just keep doing and pushing through it. It's like, well, you still have to exercise and be active, but you can't go as hard as you were before. Your body just is not functioning like it was as long as there's swelling there.
Yep. That's some good.
So what is the most common injuries you see? Like, depends on the sports. Like you play soccer, you have more like, I guess, knees or something like that.
Knees, ankles, shoulders with a lot of the racket sports, even with golf in this area.
Oh yeah.
So I would say it's a lot of definitely shoulders, just because they're very hypermobile joints. They don't have like a deep socket naturally,
like shoulders
anatomy.
Yeah.
So I'd say a lot of shoulders, and then honestly, it ranges everything.
What about the difference between athletes versus non-athletes? And I mean, like people who are sedentary, who are not moving, versus athletes. So obviously we see injuries in all the sports, any sport you do, but then can you touch on the fact that if you don't do anything, how does it affect your body too?
Over time, with the people who exercise regularly or have grown up doing the sports and athletics, they're kind of used to that sensation of muscle soreness, right? Working out, stretching, what's normal discomfort, what's not, versus people who don't do that. They're not as aware. So it's hard for them to pinpoint when you have them do exercise. They're like, well, that's uncomfortable. It hurt. And it's like, okay, well, is it hurt pain or is it hurt soreness just because you're not used to it? So you just have to encourage those people that when they're getting into whatever exercise it is for the first time, it's going to be uncomfortable as far as soreness goes. You're going to be doing things your body's not used to. And they're not always aware with it. So sometimes you have to start slower maybe you have to start out with like fewer reps or less weight or more rest breaks in between because their body's just not used to it. And used to what that should be expected for recovery as well. And with that goes into education because you have to tell them that what they're feeling is normal and it's okay and not to be concerned. But especially as people get older, if they get stiffer and they've never exercised, because we do see that in this area. When I worked in the hospital, there's women who never did any sports and now you're asking them to do exercise. And to them, they're like, whoa, like, what are you asking?
Why does my body hurt so much?
Yeah, exactly.
I don't like this.
Normal.
I know. And
Can't move today.
So you have to encourage them because it's just the generation that they grew up in. Like my mother-in-law always told me, she goes, the only sports that we were allowed to do growing up was cheerleading. There was tennis, softball, and swimming or something. Like that was it.
Yeah.
Like they didn't have all the sports that they do nowadays. So depending on who your client is or who you're working with, you have to realize that they're not going to be as exposed to some things that maybe you grew up with if you had done all the sports.
Yeah, that does make sense.
Yeah.
And I do think, touching on that topic and the question you just asked, Natalie, I want to know, so a recovery time for someone who is an athlete versus a non-athlete, is it different? Is it better? I mean, I would think it's better, or you have more of a chance of repairing maybe faster if you're an athlete as opposed to never working out before.
I would say as far as, because physically, I mean, the body, it has its own healing times, right? So it's going to heal at the heels. But as far as them mentally and what they're able to handle and like probably their baseline strength, flexibility going into something prior to an injury is going to be greater. So I do encourage if somebody's going to have surgery, if they have something happening, it helps to exercise or do stuff beforehand, just because you're getting your body used to feeling what it's has to go through in order to keep that strength and mobility up.
Yeah, that makes sense.
So Amber, like before we used to say about, talk about, cardio, a lot of people are running or like, exercising, like more cardio. Like nowadays we see all the time talk about strength training, right? Like what is your point of view about that? What
Cardio versus strength training?
yes.
A good combination. So actually, I took a really fun course a few months back and it was on HIIT exercise. And there's many types of HIIT, which is high intensity interval training for those who may not be familiar. There's many different forms of it, but I'll just use HIIT as the basis for it. And with HIIT exercise, it's not so much the length of your exercise. It's only about 30 to 40 minutes is really what you need, but it's the intensity at which you train. And they found, especially if people are not used to it and they're not used to that sore feeling, people generally have less soreness when they do HIIT exercise versus a constant cardio. You still get a cardio benefit when you do HIIT exercise, but you're also getting the strength gains during HIIT. So
it's a short period of time with very intense.
yes, it's on and off cycles.
Oh, it's on and off.
It's on and off. So you might work for it. You're trying to get to a target heart rate, and there's different ways of getting to that. I can tell you what it is if you want. But you're trying to get to about 80 to 90% of your target heart range. So it's a high heart rate. Because people might say, oh, I do HIIT, but it's like, okay, well, if your heart rate was around 120 the entire time,
doing
like
nothing.
for a young person,
right.
for a young person, 120, you're not doing much. It needs to be up there. So you have to stay at that elevated heart range while you're doing whatever exercise it is. And then you have an active recovery session where you bring it down, but you're still kind of moving. And then you go back up later. So you have these on-off cycles during HIIT. That's what HIIT exercise is. But you actually get the aerobic and the anaerobic, which is the strength gained from it. And people tend to be less sore from constant cardio. But if you're a person who's a runner and you train for marathons or long distance, you have to do the constant cardio. But for somebody, especially if they're new and they don't have as much experience, getting them exposed to that HIIT exercise might be an easier way because one, it doesn't take as much time. And two, they're going to get both benefits in the areas for the anaerobic and anaerobic.
That does make sense. Because I actually, before I started jujitsu, I would run up and down hills and I'd put like a weight vest on, but I would I'd run up the hill, run it back down, run back up, and then I'd rest and walk around like this loop for like 30 seconds and then I'd do it again.
Yep.
So it would elevate my heart rate, but at the same time, it would bring it back down. So then I'm doing more work the next time I do it. And it was you know,
And that's
few
exactly
times.
how runners can do it with their running program, where they have those like really fast, not necessarily sprint, but like striders, really fast jogging, and then they slow it down. And actually another fun thing is that people who do the HIIT exercise, they actually have a higher caloric burn over the next 24 to potentially 48 hours. So
Nice.
Yeah.
I did do HIIT a few
didn't know
times
that.
and then spin. And cause I've done a lot of different, I've tried a lot of different strength training, a lot of different types of workouts, especially before jujitsu. Jujitsu kind of, I think, just encompasses all of it. So it's great. So I don't have to do much else other than jujitsu, except like mobility and some strength, but still, doing that, I noticed a huge difference, in my body and my muscle mass, almost like within a couple of weeks. It was crazy. I mean, I was younger too, and I was doing it outside, but still. And then you're 100% know that that's true, because for the next 24 to 48 hours after I do that workout, I would like gasp more for air and oxygen. And I was like, man, is something like wrong? And then I remember researching it, and they say, no, it's actually good when you're, you know, a certain extent, but, when you're trying to grab more air and more oxygen, because your body's, your muscles, your airways, anything, like it's all, you worked so hard the day before that it's like you're still in like an active recovery type of phase, but your body's still burning those calories.
yep.
Yeah, so it's crazy.
You also get a increased production of the HGH, human growth hormone, that you get with HIIT exercise that you do not get with just a constant cardio if you just went out and ran for 30 minutes. So there's a lot of benefits to it. I mean, I also have to do constant cardio. It's just what I've been doing, but that's why it's nice even if you just add it in a couple times a week, like you're saying.
Supplement.
Yeah, it doesn't have to be your only exercise.
Even once or twice makes a big difference. I mean, we're doing yoga too. We were doing some hot yoga, and that helped. That has helped with definitely like range, mobility, and stuff like that. But I think I can only do that like once or twice a week tops, you know, because it's a lot on your body too, and the heat and everything, but it does help with certain things.
So on that topic, we were looking at yoga kind of like a supplement. So tell us about Pilates a little bit. I mean, I've never done it. I'm totally intrigued. But I'm always looking for something that we could supplement to help us, you know, with our bodies. And because we do a lot, so in jiu-jitsu, I don't know how much you know of jiu-jitsu, but, we do a lot of like movements that are inward kind of. So when we started doing yoga, like it really opened up, and it felt great, like on our hips and everything, you know? So tell us a little bit, like based on what you know on jiu-jitsu, and if you need help, we can help you. But what would you think is a good supplement? Yoga or Pilates, or what might help us, you know?
So I will say I've never done jujitsu, but my brother-in-law does it.
Oh, nice. There we go. We got knowledge. You should come to a class.
Never told me that.
Yeah, he does it pretty regularly. Well, his wife and my nieces, they're actually all certified in black belt in Taekwondo as well.
Okay.
And then he started pursuing jujitsu as something else to do.
Nice.
So I have never done jujitsu, but I did do karate as a kid when I was younger. Okay. But that was many years ago. Yoga and Pilates are both wonderful additions for really anybody. There's different forms of yoga, whether it's the hot yoga or the slow, like the yin yoga, they call it, and chair yoga for people who can't get down on the floor. Pilates, there's mat Pilates where you don't have to do it on a reformer or the trapeze table or use the equipment. You can do it on the mat. There's tons of mat exercises. Either one is a really good benefit. It's kind of, again, what your goals are. So yoga, it's a lot more stretching. There is some strength balancing movement that you go through it, again, depending on your class, which is nice. With Pilates, it incorporates a lot more. When I say core stability with functional mobility, you're trying to create stabilization, but also strength and flexibility through those areas at the same time. Whereas yoga, it's a lot more opening, twisting. You do get some stability work, but it's different. And Pilates, you are trying to get kind of when I say disassociation, we want our arms and legs to move separate from our back. And that's why a lot of people end up having back issues as we get older when they do certain activities, because they kick in, it's all or nothing. They can't stabilize through their back while they're, let's say, putting something on a shelf. So many people lift up through their rib cage, and you should be able to maintain that while lifting your arms up. So that's the nice thing with Pilates is it focuses on all those movements, and it makes it very functional, and it's very translatable to what we do throughout our day. Anyone would benefit from Pilates or even yoga. I'm speaking more just because Pilates is my background, but I did yoga for many, many years prior to doing Pilates. But whether it's a mat or a reformer class, you really have to start kind of at your foundation with, like, again, body awareness. And that's also what Pilates and yoga both do, is they create that body awareness of where you are in space, what's moving, what should be moving, and just building up the strength through there. It's not high strengthening like you think with weightlifting, but it's functional strength with the mobility.
That's important.
It is. Yeah. I mean, I think you have to start there if you're going to start do anything else, I did yoga a couple of times when I was younger, but then just started getting back into it in the last couple of months. And it hasn't been very much, but it's been enough to where it has helped. I've noticed it's helped with certain things in jiu-jitsu and the way that I move. There were certain movements that used to they would twinge a little before. And now I feel like it's elongated some things where it's not bunched or, because that's just what it feels like. It feels like everything's so compact. And then, as you heat up, it slowly starts to lengthen or expand.
Yep.
So got to get some Pilates in.
Yeah, I want to try it out.
Yeah, it is. Well,
We got to go.
You use more Pilates as rehabilitation, right? Like
the way we do it in our clinic, yes, it's more for rehabilitation. And that's the certification course I took for Pilates was the track I was actually for physical therapists. And so it does have more of a rehab approach, but you're still using Pilates and the foundation, the principles with it.
Yeah.
Because you have to be symmetrical with your movements, or I don't say you have to be, but when you do these motions or the movements, you find out and you realize, oh my gosh, I can't rotate to my right. And you don't realize that. Like if you're doing your jiu-jitsu, your movements, you might realize, oh, it's a little bit harder, but you don't realize how uneven you can become or how much strength you have on one side versus the other when you have to then start moving through it. So it is a lot of lengthening, but stability and control through those motions, which is why it's so important.
It is. Tell us about these, all the tools. My husband's a big gadget guy, and I think a lot of us get all these recovery tools. Yeah. So which ones do you see possibly help out and which ones don't? So like the massage guns, the what are those? The compression,
the Normatec,
cold plunge sauna. Tell us.
Infrared sauna.
Yeah.
Just
those. So there again, it's so funny. People can be so divided on this because I've heard some PTs talk about this and like, oh, that doesn't do anything. And people are like, oh, I love it. You know what? If it helps you, great, go for it. Now it's because it's active movement. It's not going to be like a true trigger point release in that sense, because that's usually when you need that static hold to kind of release an area. But if it's really tight or if it helps you kind of relax and you're not as tense, then if it's helpful for you, use it. I mean, my husband swears by it and he's like obsessed with the thing.
Which one?
My husband, the Theragun.
Oh, the Theragun. Okay.
Yeah.
Right.
oh really?
Yeah. Foam rolling though, big fan of foam rolling. There's different types of foam rollers. Whether it's for the hips, the legs, back. I like to use a lot of tennis balls, and there's different types of balls, lacrosse balls for like the traps, the shoulders, rotator cuff. And those can be so helpful because we can't reach it.
Can't get in there
ourselves. And that's a nice way to use it to get that trigger point, to get that pressure on it to release. The infrared, you've been seeing a lot more of that because it's supposed to help with some of the recovery and inflammation. I personally have not used an infrared mat, but I have many patients who have, and some of them, like I said, they swear by it, they like it. And I'm like, you know what? I haven't done the research into that yet, so I can't speak whether or not the science is there. But I will say, again, if it helps them, whether it's placebo effect or it actually helps them, I'd go for it.
Yeah, I feel the same way. I'm like, I don't know if this is really working, but I feel like it's working, and it could be my mind, but that's okay. If it's working from my mind, then maybe it'll translate into my body.
Yeah.
And the thing is, nowadays there's so many. Like if you want to follow everything, you get lose on you get lost on what it works, what it's doing, where we spend money and not doing anything. It's just difficult.
It is. What about heat? When should we use heat? I love heat.
I do too.
So tell me, please, I can use it.
So heat is great for when you're really stiff.
Okay.
This is getting back into that injury, right? Like if you've gone past that acute phase for like the first week or two and you're like, it's still kind of stiff, but you're not swollen.
Okay.
That's when you can use heat as a way to kind of help loosen up the area to get you moving before you then exercise.
Okay.
So if you're
flow to it, maybe.
Yes. So you can use heat, or that's why, kind of like the biofreeze or any of those things where it helps to bring kind of blood flow to the area sometimes helps because it opens it up to bring vascularization to that area. So if you are feeling stiff or you have those trigger points or you're trying to work through it, then yes, I'm all about heat.
Heat? Okay. When should we not use heat? Is there a time to not use it? Like ice?
Yeah, only in that acute phase because
Okay.
you don't want to make it more swollen.
Okay.
I always say if you're approaching, towards the end of the first 3 to 5 days, the week, and you get past it and you're like, yeah, is it swollen or not? At that point, I'm like, worst case scenario, if it helps and you're feeling a little bit stiff, try the heat, but then you could always throw ice on afterwards. What they call contrast therapy, where you kind of alternate. So it helps to loosen you up, but then you're not overheating.
Okay.
Got it.
Yeah, that makes sense.
Great.
Yeah.
That's nice.
Yeah.
I have a question. What advice would you do for a person like, or jiu-jitsu, or like any athlete, like a runner, or like on the 30s, on the 40s, and on the 50s, or
50
on
up.
the 50s?
You're saying as far as how to progress through.
Yes, like how to keep their body healthy and longevity, go, be active on the 80s, on the 90s. So what they should do on the 30s, on the 40s, on the 50s, how they would, what do you think? Like, what do you?
I think the combination of everything we've been talking about, the strength training, which is so important, maintaining flexibility, which will also help decrease risk of injury, because so many people all the time don't stretch. And I don't say, oh my gosh, you have to spend an hour stretching, but doing like the active stretching, like the yoga and the Pilates, things like that will help to maintain your flexibility, but you're also getting the strength trains, but you're not, static stretching is great too. Like some people have to statically stretch, but so many people don't want to do it. And I am guilty of that myself because it's so boring to sit there and be like, okay, now I'm going to take 20 minutes. I'm like, most people, if they don't have time in their day, they're busy.
To squeeze it in is hard.
They're like, I'd rather do 20 minutes of like a hard run or weightlifting. And it's like, stretching.
That's what I'm thinking.
They're like stretching. Who needs that? But as we get older, our body becomes less elastic. It's just the way the body is designed. We get stiffer. We don't maintain that flexibility. So we have to put more effort as we get older to put the emphasis on maintaining the flexibility or stretching into our program, right? Because when you're in your 30s, you may not have to focus it on as much. No. But honestly, that's when you should start
right?
To build up those habits.
We don't know
I'm 33, so I've started this since doing jujitsu. I definitely stretch more, but I don't stretch enough after. But I do stretch a lot, like when I'm at home, like. After I get out of the shower too, and my body's a little warm, I will put like magnesium on. And like,
I don't do that after. I'm bad on that.
And then I will stretch a little bit for like 5 or 10 minutes after. And then that's as much as I'm going to get right now.
Yeah.
But it's a couple of times a week.
At least it's something.
Yeah. It's better than nothing. Yeah. But yeah, definitely preventative. I think I've been learning, especially because I've always been the person that's, I'm always in a group that's like, there are women who are older than me or people who I can,
You're the baby.
I'm always a baby. So I always get all of the advice and I'm like, I'm going to learn everything now. And I'm going to do it now and I'm going to start it now so that in the next 10 or 15 years, if I'm, still on this earth, hopefully, I can still do what I'm doing, or at least half of it or as much as I can, as long as I'm able.
Yes. And that's honestly why what you're saying is true, because so many people, that's how they get injured. So because they only focus on the hard exercises or they only do that, but they never take the time to incorporate it. So over time they get stiffer and tighter, more restricted. And then that's when you tear something or you injure something. So that's why adding in foam rolling every so often, like a couple times a week, if you're exercising a lot, and then you can do the stretching. So just something to maintain what you have, because that's truly when we see the most injuries is when people never take the time for that post exercise recovery.
Okay.
I have one last question regarding that. So when we're in our 20s, like we work out or we do crazy stuff, right? We're like not kind to our bodies and we don't feel it, but now we're feeling it, right? In our 30s, 40s, I know for sure I'm feeling some of mine, but how much of that could have started in my 20s? I'm curious, like, have you seen effects that are like injuries from when you were 20? Like if you were like skateboarding, going hard, hit your hip, and then you ignored it, and then 20 years later, it's
absolutely,
like,
because so many people do ignore it.
Yeah.
And our body is so smart at subconsciously adapting to what we have to do. So if you had a mild injury and you're like, it's fine, like, because that's what everyone did when you were 20. You're like, it's fine, I'll just forget about it. Your body, though, is already going to be adapting to it without you realizing it.
And everything's out of sync.
So then you start to change probably how you move, and you may not know that. Mm-hmm. And then over time, that can lead to other different movement patterns. So a very common thing is sprained ankles. Like how many people have rolled an ankle? Mm-hmm. Now, if it's mild, it swells a little bit, goes away. You're like, it's fine. Thankfully. Well, most people don't bother doing balance or strength training or rehabbing an ankle when it's that mild, because you're like, I can do whatever I need to. Why worry about it? But it automatically changes how stable your ankle is, which can lead to risk of re-injury. Your balance automatically changes. It's not as stable and supportive. So then over time, then they roll it again more often than not, because they never took the time to properly rehab it. And now it's even more unstable than it was, because now you've rolled it twice over the time. So it's things like that you see where people kind of ignored it. They kind of dealt with it and you're like, oh, it's okay. Well, it's not really okay. You're just kind of ignoring it and your body's just working around it. But if we can take the time, and it's so hard because, I mean, when you're young, it's like we could look back and tell it ourselves, right? We're like, if I could go back and change like whatever it was in my 20s.
Talk about that all the time.
I do a lot,
but that would set you up for better success down the road.
So say I'm a 20-year-old and I just rolled my ankle or my wrist, injured it. What's the next, like, what do I do? Should I go see a doctor of physical therapy? What's my best route to make sure that if I'm smart and I'm wise, that I address this and make sure that I don't make a habit to where it's worse later?
So everyone always hears RICE, right? After an injury, rest, ice, compression, elevation. So if there's swelling, that's what you want to do immediately. Depending on how severe it is, I always say it doesn't hurt to go see a physical therapist. It doesn't mean you have to stay in therapy for that long. Maybe they just have to do an assessment. They can give you exercises or whatever it is that you have to do. It just depends on how bad it is. But it doesn't hurt to just, I always say, pop in to get an assessment just to see.
Yeah. And how can someone pop in to get an assessment on their like whole body at physical therapy? Like, how does that work? You know, I've been to physical therapy for specific injuries, but like what you're saying is kind of like, if my ankle's messed up, it could mess up my knee, my hip, so like, how do I make sure I go see someone that's good? Like, what could they do? How do they look up? Do they look up a sports specific one? What are the steps that one needs to take if they want to take it further than RICE?
If
it's serious, for example.
So if somebody has an injury or not, generally the way it works because of insurance, most often you need some sort of diagnosis to go see a physical therapist. If it's an insurance-based thing, where I am, you could just do it as like a out-of-pocket thing to come see us. So we could do an assessment if somebody had a specific area and they weren't sure where it's coming from, then that's something we can check through, because we can see, is your ankle stiff or is it really mobile? Is your hip mobility the same on side to side? Is there a posture? Is there something off? So it's definitely something that could be screened if it was something that you wanted to do. They actually do that at a lot of Pilates places as well. They should have you do some sort of functional movement test when they see you. This is how it's supposed to be, but they should do some sort of functional movement test just to see generally what is your shoulder, thoracic mobility, hip mobility. And then they can also kind of cue into, all right, where do we need to strengthen or focus on? Like, are you really missing a lot of, shoulder and upper back mobility, or is it your hips and your legs? So they can do a general assessment through Pilates as well. But PTs, they can definitely do a screen on some stuff, but generally if there's an injury, we cater into that. But you're exactly right. If somebody's ankle's off, and this is a personal experience as well. My left ankle has been very stiff, which has been affecting my hip, and it's been affecting the whole chain up into my back. So I can't just look at just the ankle. Yeah. I also have to address what's happening at my back and hip as well, through the recovery process. So yes, there are times when it is very much relatable throughout the body. And if you don't address it early on, it can progress into
like a domino effect.
Exactly.
Got it. Okay. Well, that's good to know.
Chain effect.
Yep.
Important.
Yeah. Well, that's all for me. I'm good.
Yeah, I think me too.
Any other questions?
Picked your brain a lot.
I know. Thank you so much. We did
this is great.
You're welcome.
We ask all these questions to ourselves all the time too. If we're like, man, I twinged something, and like, I don't know.
We need a doctor to tell us because we're like, we'll be good. It's not good.
Oils, and then I'll be okay in like 2 days, and then you're like, it still hurts.
Yeah, I think this will be beneficial to a lot of the people at our gym too, and at all the gyms, because we are, as athletes, that's like you said, we're aware of like soreness. We push through, we're good, and we tend to know when it's a little bit off, but we tend to ignore it because that's just how our brain works. We push,
until it comes to like a serious standstill, and then you're like, man,
I should have listened.
There were signs. Like, there were signs.
Yes, if you can address it the minute you start to have signs.
Yes.
But we don't.
Yes.
Here we are.
I'm also I've gotten definitely better in the last few years, but I was definitely a rowdy like kid. Like, I've broken so much stuff, but at the same time, like, now it's actually, I think it's helped me because I mean, I don't just, I really try to take care of it and like get to the root of what it is, not just because it's my hip, it may be my shoulder that's actually bothering me. And now it's just transferred into my hip too. So I'm like, man, what did I do?
Well, not me. I cannot use my shoulder, so I took soccer classes. And then I used my feet. I don't know if it was a good move. But
It was not a good move. She's got a bruised knee and
Let's take care of the other limbs.
thank you so much, Amber,
Yeah, you're
to,
welcome.
Thank you.
taking your time to come here. And like, I know you have 3 little kids.
Man.
And that was awesome. Thank you so much. I
Really.
appreciate it.
You're welcome.
Yes.
Thanks so much for watching us today. Please share with your training partners, friends, teammates, and follow us on YouTube and Spotify, Gi Squad Podcast. We're going to finish with a quote from Carlos Vieira. There is no secret at all to get to be good at jiu-jitsu. All you have to do is show up and train.
Nice. Thank you.
Thank you.
Have a good
Thank
one.
you.
Bye.